When I was getting ready to talk to you today, I read a really frightening statement, which was that in California in 2013, more women who were pregnant died of heart attack than anything else. What is going on with women who are pregnant and heart disease?
Pregnancy is really the first metabolic stress test that women have in their lives, and it could unmask an underlying heart issue. What happens during pregnancy is that the arteries need to dilate and supply blood to this growing fetus. And if the arteries are not healthy, which is really what happens in heart disease, other issues will develop. And that's when we see things like high blood pressure, preeclampsia, diabetes, gestational diabetes, even elevated sugars. And we will see women whose arteries are not healthy or whose metabolism is not healthy develop these issues. The most amazing thing is that when a woman has gestational diabetes, 70% of them in 5 years will have diabetes. There's a twofold increased risk of heart attacks in women who have preeclampsia. And what we understand during this time of pregnancy is the fluctuations in the hormones can actually lead to a heart attack, can lead to clots, can lead to strokes, can lead to dissection of the arteries, and that's purely at the moment of pregnancy in the third trimester and a month thereafter.
So women take their prenatal vitamins. They'll start getting their bodies ready for pregnancy in terms of hormones and nutrition and things like that. But should they really also be having a stress test? Should be getting all their cardiac tests in place before they get pregnant or think about it?
I always tell women that when you get pregnant, pretend you're going to train for a marathon. So it's not necessarily about getting a stress test, but it's not just about taking those prenatal vitamins. It's really looking at your diet. It's not gaining too much weight. It's exercising, but exercising before the pregnancy so you go into it healthy. The healthier you are when you get pregnant, the better chance of having a healthy pregnancy and a healthy baby and coming out of it being okay. Because when these issues come up, like blood pressure issues, like sugar problems, that's when your risk of heart disease goes up as well.
And I'll ask, this is probably an obvious question, but I'll ask it anyway. The people that are at the highest risk of having these problems, did they have weight issues beforehand and diet issues beforehand and weren't active beforehand? Or again, can it happen to, healthy, active, skinny mom?
I think it's important to understand that the risk of diabetes and high blood pressure goes up when a woman is obese or has these risk factors beforehand. Certainly her risk of preeclampsia will go up. But if you are thin, it doesn't make you immune to the problems that can happen when you're pregnant. So one of the things I say to women, if you have any chest pain, shortness of breath during your pregnancy, it is so important to talk to your doctor. Maybe see a cardiologist, because the diagnosis is the difference between life and death in these situations sometimes.
Right. Okay, women, you're getting pregnant. It really is, you're running a marathon. This really, having had 2 kids, oh my God, it's really hard.
It's running a marathon.
Or 2, yes. All right, thank you, Suzanne. Great advice. If you liked what you just watched, please let us know. Make a comment on the video. Do that social thing. Share it on Facebook. Share it on Twitter. Share it on any of those social places that you like to go. And come back to bottomlineinc.com for more videos with Suzanne Steinbaum and more of our Bottom Line experts.